My name is Michael Covell, and I'm a second-year medical student at Georgetown University School of Medicine. I will be discussing our study titled Social Determinants of Health Impact Spinal Cord Injury Outcomes in Low and Middle-Income Countries, a Meta-Epidemiological Study. Thank you to Dr. Anant Naik, Dr. Paul Arnold, Dr. Gail Rosseau, as well as our co-authors in the Neurosurgery Publications Journal Highlights series for the opportunity to share our work. Spinal cord injuries pose a significant global health challenge. They are disproportionately impacted in low and middle-income countries, and access to appropriate surgical care and barriers to treatment remain poorly understood. Data from LMICs remains particularly scarce and underreported. Previous studies include primary retrospective analyses and global burden of disease investigations, which provide valuable information regarding neurological outcomes but are limited in their comparative value. Because of these limitations, we performed a systematic review and meta-analysis of the literature on spinal cord injury studies in low and middle-income countries, as defined by the World Bank. The objective of our study was to examine the pooled in-hospital mortality, follow-up mortality, and neurological outcomes following SCI and LMICs. We identified 45 studies across 13 countries with 18,134 patients. We collected baseline epidemiological characteristics, and our primary outcomes included in-hospital mortality and in-hospital severe neurological dysfunction. Country parameters to represent social determinants of health included economic stability, education access, healthcare access, neighborhood and built environment, and social and community context. The aggregate pooled in-hospital mortality rate was 6.46% and 17.29% at follow-up. Vietnam had the lowest in-hospital mortality rate at 4.29%, while Ghana had the highest in-hospital mortality rate at 16.22%. The in-hospital severe neurological dysfunction rate was 97.64% and 57.36% at follow-up. The lowest rate of in-hospital neurological dysfunction was 52.17% in Malawi. At follow-up, Nigeria had the greatest rate of severe neurological dysfunction at 70.15%. Social determinants of health had a robust impact on spinal cord injury outcomes in our analysis. Rural injury was associated with a four-fold increased rate of severe in-hospital neurological dysfunction. Higher GDP per capita was associated with a mild increased rate of in-hospital neurological dysfunction. Higher HDI was associated with a 16-fold increased rate of in-hospital neurological dysfunction. Higher Gini index, a measure of income inequality, was associated with a 23.8% increased rate of in-hospital mortality, a 12.9% increased rate of mortality at follow-up, and a 20.1% decreased rate of neurological dysfunction at follow-up. In summary, spinal cord injury in low and middle-income countries are underreported, under-resourced, and robustly impacted by social determinants of health. A notable limitation in our study was lack of patient data at follow-up. We believe future initiatives may support infrastructure and systems to improve disease reporting. Thank you for listening.